Welcome and thank you for joining us. I'm Richard from AVIL, and I'm the National Bloodborne Virus and Programs Lead. Um, at the moment, we're still waiting for two of our panelists to join us, but we're going to make a start anyway. I'm talking to you from the border of Waterloo and Redfern. This is the heart of the Gadigal land, the land of the people of the Eora Nation. For many thousands of years, this was a place of music, art, and culture, and more recently, resistance. This is Aboriginal land, always was, and always will be. Sovereignty was never ceded. So I welcome to all Aboriginal people on the panel and to Aboriginal and First Nations people who are joining us today, and I'm proud to call myself an ally. I also want to acknowledge that all our panel work full time, and hopefully Mark and Emily will join us shortly. But I'd like to thank Emma from Quiver, Jeff from Queen, Mary from Newer, and Jane Dicker from HR Victoria for altering rosters and that allowing our panelists to join us and have a yarn today. Now, there's a bit of housekeeping first of all. We have a question and answer button down there. Please use that at any time. If there's any questions we can't get around to today, we'll respond to you personally. We ask you to be respectful and just this session is being recorded, but only what you're seeing on the screen is being recorded. We have closed captions in English as well, and yeah, please use the question and answer. Today is the World Day of Social Justice, and we want to challenge that the jailing people for drugs isn't justice, it's a systematic failure that harms individuals and communities. Hi, Mark, thanks for joining.
Sorry, I'm
Now,
late.
today we're exploring a central idea. People who use drugs deserve care, not incarceration. We'll look at what it means to be inside prisons during transition back into community and through alternatives that would genuinely reduce harm. So I'm going to introduce my panel to you now, and if you'd just like to introduce yourselves and say a couple of words about yourself, and then we'll start to ask the questions. So we'll start with Esha. Esha, how are you? Hello, Esha.
Um,
You're on mute.
Hello. Sorry about that. Can you hear me now?
Yes, we can.
Excellent. Awesome. Hi, I'm Isha. I'm a peer harm reduction coordinator at Queen in Burley, and also a vice president of the ABLE board, and have been in incarceration twice in Queensland. Welcome.
Thank you. Rod, would you like to introduce yourself? And you're on mute as well.
Me?
Thank you.
Okay, sorry. Technology and I are not best friends. My name is Rod. I work for Newer. I've worked for Newer for about 13 years. I started for their volunteer program and have worked through. And my present role is I am the BBV outreach team lead. And we go up to regional and country New South Wales and perform Hep C testing. Um, I've been incarcerated. I'm a slow learner after Isha. I've been about 14 times. Not real clever, am I? So yeah, not a nice place. One day in there is far too many. That's me.
Thanks, Rod. And Mark, thank you for joining us. And thank you. I really appreciate the fact that you're on outreach today and you've taken this time out and Jane's given the time up. So thank you. Introduce yourself, please.
Can you hear me? Number one.
Yes.
My name's Mark. I work for Harm Reduction Victoria. I've been an injecting drug user for about 30 years. I work on the See No More van where we do Hep C testing, which is corrections focused. So most of my days are hanging at the front of Office of Corrections. And I've also been to prison, used drugs in prison, all of that stuff.
Great. Thank you. So I suppose to start the conversation, as I said, we're going to discuss first of all treatment and harm reduction. Then we're going to look at the preventing post-release deaths, and then we're going to talk about alternatives. So I suppose my first question was, what does effective opioid treatment therapy look like inside or any other therapy? And what's the biggest operational choke points can we remove? So how does a punitive approach increase harm reduction, including transmission of bloodborne viruses where NSPs are absent in our country? And what measures could we possibly deploy? And also, what harm reduction minimum should every prison meet? So, who'd like to go first?
I'll throw my
Mark.
2 cents in.
Mhm.
That's a really tough question. I mean,
Uh,
even just going to ask for bleach from the screws can have basically the piss police visit you the next day. So harm reduction doesn't really exist in prison. Yeah, that's the last time I went to prison. That was the go anyway. I mean, if you went and asked for bleach, they'd be onto you basically. So yeah.
I'm sort
I
of,
might go next then. In Queensland, we don't have bleach or Fincol like they do in other states. So practically there is no harm reduction um, practices involved. So all they've got is just, the running water. So yeah, we're pretty underprivileged in the prison system in Queensland.
New South Wales, basically, you go inside and you have no rights as a prisoner. I mean, you are told to go from point A to point B. If you're going to work, everything is very controlled. So, I mean, the concept of having harm reduction just isn't there. You know, the nurses from Justice Health in New South Wales, that's what they're called here, do the very best and whatever, but you're working always within the correction system, and it is very, very what's the other one? Fixed. There is no movement. There is no individuality. There's no anything like that. It really is about being a herd mentality, and this is where you're going, and this is where you're going to be, and all like that.
thanks. And also, Molly, obviously, you're not allowed to smoke or drink alcohol in prison, but a lot of people who go to prison are heavy smokers and could be heavy drinkers. And so suddenly you're going into basically shock treatment. What about other drugs? Say if you've got ADHD medication or other prescription medication, or maybe not prescription medication you're using, how hard and how long does it take for you to be able to get that from the nurses?
It depends on, for New South Wales, it depends on what it is. So if you're on some sort of, let's say it was a heart medication, it happens relatively quickly. And
Hmm.
it's you fill out a form and you go through entry, giving permission to contact your GP on the outside, and it can move quite okay with that one. If you were on something that was for ADHD or something like that, that dexamphetamine, let's say you're on dexamphetamine, that will take longer to come through and you might not get it. So that has been my experience inside. But anything that was like, you do go cold turkey. Nicotine replacement is available in New South Wales. I don't know how that starts because I'm not a smoker, but that is available in New South Wales. But as far as alcohol goes, it would be cold turkey.
Yeah, and I
Mm.
think also for people who are heavy drinkers, if you would suddenly stop, you could be in severe risk of heart attacks and things like
Mm.
that if you're not being given Valium or something to level that out. How about you, Mark?
Um, with things like buprenorphine and those sort of things, you're basically making yourself a target if you get put on the strips. There's a whole thing of people getting stood over and all that sort of stuff that goes on with the strips. But I know that they're now offering the Sublocade and Buvidol, same thing, like basically the Suboxone injection in prison, as far as I know. I haven't been to prison for a long, long time. So, but the last time I was in prison, yeah, that's what was going on. Is people were getting stamped for their bupe and
Oh,
basically
really?
getting forced to bring it back to the yard, and if you didn't, well, the consequences. So there's just that many complications with opioid replacement therapy in prison. So yeah.
And Esha?
So in Queensland, they've just started introducing the OST to prisons, but you can only get the injection, which is great, but it's a long wait list. But if you're on it on the outside and go inside, you should always have a letter from your prescriber to take with you, because it does take a while to be able to, for them to even read the letter. Which is great, but I suppose it's got to do with high risk medications to none. So say like what Rod said, if it's a heart medication, of course you'd be able to go to medical for that. But compared to dexamphetamine and stuff, there's no way in the world they'll hand out dexamphetamines in prison. It's taking this long to get any OST in prisons, let alone any other medication. When it comes to if you're withdrawing from alcohol, too bad, so sad. You just need to go to the medical and just go cold turkey. So yeah, don't really help you much.
The last
And I know the Quinn does quite a lot of work, harm reduction work in prisons. How useful is that, do you think, when there's no NSPs available?
So at one stage, the Gatton Women's Prison was private. So they asked myself and my co-worker to do brief harm reduction webinars with some of the ladies in there, because there was a lot of ladies losing limbs from injecting.
Oh,
We only did like 5 or 6. It was amazing how much the inmates didn't know regarding bloodborne viruses.
mhm.
And the funny thing was, the people that did come to the webinar, I knew most of them. So I was like, you can ask any questions, So I think it made it more open, but they were just,
Yeah.
there was no washing the syringes out after use. So, just giving those techniques of trying to wash it out, between uses, if you just wash it out once or twice. And they were like going, we just can't, because, we've got 2 minutes to
Mm.
all have something, just trying to, I don't know, wash their hands or whatever we could say to them at the time. But, I was quite shocked on how many of the inmates had no idea regarding bloodborne viruses, and had to think, okay, we better start from the start. So where's the start of educating people? So it was it was challenging, but then they stopped and went public. So they stopped the webinars, which I think were really good for the ladies. It would have been good to do it in the men's jails as well, just to be able to be open and ask questions would have been great. I know that Quinn does provide, they've got a QCS program, so they do education in prisons, but I'm pretty sure it's more like relapse prevention, values, etc. But they would do some harm reduction stuff in there as well. But what can we say? We can't get Finkel in our Queensland system, so just have to try our best.
Thanks. And Rod, I know you're working on the National It's Your Right program at the moment, and you're working with inside the prison system as well. How successful are you looking at that? You're doing testing as well?
Um, we okay. So Newer as an organisation works with Justice Health, and we go on their blitzes when they go to different jails. So we'll send some of our peers into do peer engagement and work with the health staff to get people tested. That's been our extent of entry into the jails themselves as an organisation. We are trying to do some educational work with Derwynyia, which is the ladies' prison at Silverwater, about education and stuff like that. And its progress has been slow to be taken up because of the bureaucratic way that corrections sort of operate. They're very slow, and it's all done at their time frame, and we're sort of stuck in red tape and paperwork. But we're hopeful to get that up and running, to do some of that before the end of It's Your Right 2 finishes. So all we can do is try. That's the biggest thing. If we don't try and help, then we are no better than they are, and that's, I think, something we have to just keep remembering, that we're trying to do the right thing here. We're trying to make sure that we reduce the illness, because the guys might, for example, get Hep C in jail and then go home and share with a partner, and the virus just keeps on spreading. It means that I'm going to be employed till I die, because we can't put things in place to allow what the government wants to eradicate it. But it's the government who's stopping it in lots of ways. Do you know what I mean?
Yeah,
It's known that the jails are, higher prevalence in the community, and they're trying to do something about it. But at the back end, there's no cleaning facilities in Queensland, or and what's available in New South Wales now, I believe, is only FinCult, and as Mark said, the minute you put your hand up for something like that, if it's not in, the washroom or whatever, you get looked at, and they've got nothing better to do. The next morning, you're up for a test, or you're getting ramped. The cell's been tossed.
Great, thanks. And we've got some questions coming in. So, Jennifer's asked, do doctors and nurses not offer a symptom treatment for someone going through withdrawal in prison? We know when we ARDS see people in the watch house, they're offered free withdrawal treatment in Queensland. Is that across the board in other states or not? Mark,
Well,
how
I
about in
wouldn't, I
Victoria?
wouldn't say it's free withdrawal treatment. It's thrown in a cell and, like just put up with it really. If you might get an ATODS nurse coming around to give you some Valium if you're lucky, but every time I've been thrown in the watch house, I've never had any withdrawal treatment. So I suppose it depends on who you
Hmm.
are. Yeah. It depends what watch house you get locked up in, I suppose, as well.
I wouldn't think that the nurses have the time to do that in a sort of individual basis, because quite frankly, when you go into jail, you can put a request in to see the nurse every day and it can take 6 weeks to still see them, and so I wouldn't think that they would have the spare time to do that. I don't know that in New South Wales. I'm not gone in to need support that way myself.
Yeah, because all the states and territories are different. Yeah, because Josephine, Yvonne just asked about GSP. GHB has serious side effects when detoxing and can lead to death. And Josephine said in the ACT system, people are given Valium 3 times a day over 4 days, but they're quite often hospitalized. So we have a huge problem here as well.
Mm.
Um, and is there 24-hour/7 medical support in jails? Jude's asked. So, absolutely not.
No way.
Okay.
There's no nurse on 24 hours a day, 7 days a week in, I think, any Queensland prison.
And I doubt there's a doctor on. You might get a doctor once a week at a prison. They're not
Mm.
on staff. They're not on staff at the time. There's nurses, but not doctors.
Mm,
And I don't think anyone would really answer your bell when you are calling through the night if you are like really sick anyway.
Hmm.
thanks for that. It's quite scary, actually, isn't it? And I'm just wondering, what do you guys think? What do you think the harm reduction minimum should be be met in every prison? Not, because the states and territories is all different. What would you say the harm reduction minimum? It's a hard one, I know.
But in a dream world or like
In dream
realistic?
worlds, yeah. What would we like to see? What are we working for here?
Listen, like I reckon needle and syringe program in every prison would be
Yep.
great. I'm not sure how the model would work. So that would be interesting on trying to create a good model that people aren't like standing out like dog's balls to go and get access the needle and syringe program, but and everyone to be access to OST treatment no matter, who you are and how, if you've been on the outside or the inside and how long you've been in there for. I think everyone should have access to it straight away.
It'd have to be peer run because otherwise the whole police visit comes with it again. So it would have to be peer run. So
And I think the other thing is too that people are entitled to have a medication. Who is a doctor or nurse to overturn another doctor's prescription? So we go back to dexamphetamine again because we know what it is. If I've been prescribed that by my doctor on the outside, why, and I need that or something of equivalent, why then can another doctor turn around and say, no, you don't?
Yeah, exactly. Yeah, we've got it from the first.
Totally
And
flip
it's
it.
an interesting, yeah, it's an interesting fact. I think there's about 87 or 89 countries in the world that have needle and syringe programs for everybody, but there's only 8 countries in the world who actually have needle and syringe programs inside prisons, and they're all a little bit different. There's usually, they're not, I think there's only about one that's peer-led somewhere in Spain, but the rest are actually done by, nurses and clinicians, but I think we're definitely missing something there because of the high rates of especially hepatitis C transmission within the prisons. So just
they'd,
like
they'd,
moving
have,
along
they'd
now.
have to admit that there was drugs in the prison first, which they're not willing to admit that for starters anyway, that there's drugs in their prison. So
Yeah. I think there's more drugs in the prison than there is on the outside sometimes. So, but,
yeah.
like I think there's no drugs in prisons. let them think that
no, exactly. Yeah.
prisoners
Yeah.
supply, organize their own needle and syringe programs. So, it'd be good to be able to give them sterile equipment to be able to supply to people.
Thank you. Yeah. So we're going to move on to this one now. Transition into community. So preventing post-release deaths. Is the high risk of post-release period? What specific steps can we do to prevent deaths? And actually, who is responsible for this? And probably what policy change would create the biggest impact?
I think everyone being released with some naloxone would be great.
Hmm.
It'd be awesome in a dream world that the person getting released gets picked up and taken to parole, Centrelink, and housing. So there's no risk of them, like bumping into someone, having nowhere to live, no clothes, no money. I think there needs to be so much more support for people getting released from prison than just thrown out the door. Half the time, when you get transported from jail to W, you don't even know where you are when you get released. So for myself, I had no idea where I was when I was released from Brisbane Women. So I was like, where the heavens am I? There was no help to get to a train station or anything. So I think there needs to be way more support. Yeah.
Hmm.
I agree. I
Mark?
mean, basically,
Ross?
as far as, hey? Hmm?
Yeah,
Sorry.
go.
Oh, okay. Good. I agree. I mean, because basically there are three things that most of our people need when they get out of jail, and they've got to do them all basically at the same time, which is going to methadone clinic, otherwise they're going to get sick. Centrelink, because I have no money to pay for the methadone, so they should get sick, and parole, because if they don't do that, they get breached, so they get back inside as well. And none of those places are ever close together. And we don't give them in New South Wales, it's called an Opal card. We don't give them an Opal card with $20 on it so they can get between these places for the first time or anything. Simple stuff like that, I think, would be a great benefit, because the thing with it is, if you live in one of the towers at Redfern, and there's a dealer on one of the floors up there, you can pop up the elevator, get a fix, and the whole cycle starts again. There is,
So, yeah.
because it's not necessarily easier, but it is easier because all of that other stuff's really hard work, to get there and to be motivated and and walk past people are using and in those areas. Because I got released from jail back in 2012, 13, whatever it was, and we'd moved while I was in jail, and we were living in Waterloo. And guess what? Waterloo was my delivery area, so I knew every second person. So there goes my business just started all over again. But
Yeah.
so more assistance, I think.
More assistance. And Mark, how about you? What support did you get?
So in Victoria, they do give you naloxone when you leave prison, but it's the same old thing. I mean, personally, when I was in prison, I couldn't wait for the day I was getting released because I knew I was going to go have a shot and all the rest of it. And a lot of the times you're doing this stuff by yourself, and even if you've been given naloxone, well, it's pretty hard to use it on yourself if you're dropping. So I mean, it is wonderful that they do hand it out, but at the same time, it's a bit hard to self-administer or know that you're about to drop and all that sort of stuff. So there is so many things that need to be sorted out. Like it's all pie in the sky stuff though, really, because I can't see anything changing for a long, long time. So yeah.
No. Now, Jude has just said ACSO, and I'm sorry, Jude, I don't know what that stands for, have taken over men's reintegration program and can support people for 3 months prior to release to help upset the necessary stuff with ID health. So that's a really good thing to know. Anecdotally, I've heard in New South Wales that at Long Bay, they tend to release people 4:30 or 5 o'clock on a Friday afternoon. So everything's closed anyway. You're not going to be able to get to Centrelink. You're not going to be so saying what you've always said. Yeah, you're going to go straight to your mate's place and probably get back into the cycle again. So what what do you think the biggest policy change we could create for this impact to support people who are being released from prison? It's not standard across the states and territories.
Policy impact should be that they should be given food, clothing, toiletries, the hierarchy of needs is they should go by that. because, and to try and support them a bit more, and not lock people up for using drugs for a start would be great. I think our prison systems would be very empty. But just to be able to have someone to support them, like for example, I had no idea where I was. And eventually my girlfriend did pick me up hours and hours later. But I had no clothes because I got locked up in my nightie. I had to get someone to pinch clothes from the sweatshop for me to get released. There was, I only had like $10 or something, but maybe even get Centrelink like when you get released, have a payment there so you've got some money. I mean, maybe even a mobile phone as well. I've had a client that's just done 25 years and had no idea what a mobile phone was or how to use one. So, just that little bit of help would be great. Or even like to get onto Centrelink, didn't know what was an email address or anything. So,
Yeah.
or new to them.
Yeah, and how do you access it abroad? What do you think? Okay, Mark, I'll ask you. That's so quiet. And you're on mute.
These are all pretty tough questions. I think housing. I mean, housing has to be number one. Getting released back to the street. What hope you got? And I live in quite a big housing estate, and there's always heaps of flats that are left unused for months on end. So housing has to be the first one, I think, and then everything else filters down from that. If you've got somewhere to actually go when you walk out the door instead of back to the city streets or back to the flats, or it's just going to end up repeating the cycle again. So I think housing is really important. Getting set up with a doctor, if they put you on Sublocade or something while you're in prison, linking you in with a doctor that's going to continue that for you. The list goes on and on.
Doesn't it? Rod, do you have any thoughts on that one?
I think what Aisha said about the Centrelink payment going in, that's normally everyone's released on a date. You know what I mean? You've got a sentence date and you get out on that day. So a Centrelink payment due on that day that you're going to go out. So you've got something to go and buy your bus ticket to go to the other places. Because, if you weren't getting supported by family and friends for your buy-up and stuff and you were living on your jail money, you're not going to have any of that left. You know what I mean? It's only $16 a week or something in New South Wales. So, you're not going to have any of that thing to go. An Opal card, it's $20 on an Opal card will get me from Long Bay to Redfern and around for a little while, and stuff like that. That's good. Mobile phone would be good. It doesn't have to be a big thing. It's just a little cheapy because
that's it. Yeah,
contactable. Methadone clinic, Centrelink. Or you get logged in that way, and parole, community corrections. So the really small things, and I imagine it would cost $1 million to do it all. I mean, no one's got any budget, so that's the first problem. But those little things would make life so much easier for getting out. Just tell people you're safe. Ring mum and tell her you're out of jail and you're safe on your new phone. This is my new number.
Yeah, you can get out and think. And according to the National Drug Strategy Household Survey 2022-23, 17.9 of Australians reported using illicit drugs in the last year, and that is actually 3.9 million people. Now, could you imagine if 3.9 million people were suddenly, when handed themselves in or arrested and were put to jail, how the system would collapse? So it's obviously it's very inequitable. Some people go to jail. I'm pretty sure if I was walking down the street and I was picked up and I had some drugs on me and I was on my way to a conference, I'd probably, just because I'm a middle class, self-entitled white man, I'd probably just be given a warning or something like that. But if I was a youth person, a young person, an Aboriginal person, I think the outcome would become very different. So there's definitely a lot we need to work on here.
Can you imagine the political power that we would have as a group of drug users under one umbrella? So we take away the meth use and the heroin use and the cocaine use and whatever, and just put it as drug users. how much political power and clout we would have to change things if we stuck together, rather than me being, oh, well, I inject ice and Isha smokes it, so I'm lower than she is or higher than she is in the hierarchy.
Yeah,
Put all that crap
very
aside
much so.
and became one group of lobbyists. What could we change? What could we get done?
I think in some ways this is why I'm trying to start this conversation. Um,
Mm.
there's a long way to go, but I think we're already starting this, and we're going to be working on it. Um, the so I can't remember the next question. As Candice said as well, um, and also your parole can be at risk if you don't have a stable address, which means the cycle starts again. You don't have a stable address, so you move around. Sonia said also considering pathways to centrally accessing benefits prior to final release and release to homelessness with no access to finance drives well, I can't remember now. So yeah, and you need safe locality. So I mean, this is it. Diversion programs, and also, as Peter said, diversion programs do get rolled back at many times indeed. So
Mm.
thank you for that. Now I'm just sort of looking for my next question because, um,
They won't actually give you parole in Victoria unless you do have an address to give them. So there you
okay,
go. So
hmm,
yeah, if you don't have a stable address or somewhere that you can tell them, they won't give you parole anyway. So
right,
It seems to be
that's
different
very
in New
hard.
South Wales.
Yeah,
The New
same as
South Wales it seems to be
Queensland.
easier. Yeah, they'll give a
And I
temporary
think,
housing
yeah,
place or one of the motels and stuff. They can be released to there. I know a couple of people in recent times, in the last 12 months, that have been released to one of the halfway hotel things. That where they crisis
mm,
accommodation, that sort of thing. They've been released to that address.
Mhm.
no, thank you for that.
We don't have
I
any
just want
crisis
to
accommodation up here in Queensland,
go then.
unfortunately.
Mhm.
We don't really have crisis accommodation. We've got boarding houses, but like it's only if there's a room available for a parolee to go into. And some of the other parole boarding houses are very strict, and you need to they're run by church religious groups, and you need to you get put through torture, which I've had a few clients be released to one of these parolee homes, which was like sort of a rehab, but it was really religious, and they spoke tongues to them and stuff, and it was just like, yeah, it was dreadful. But that's the only place I think, oh, well, on the Gold Coast that they'll accept parolees.
So I was
So it's
just
like a
looking at the
cult.
question. Kirsten was just asking, is there a collaboration between Naval and other people who use right groups in prison of others or reform groups? And yes, Kirsten, it's something we're definitely looking into. At the moment, Emily from Tasmania, Emily Ebden is actually doing a prison visit this morning. So we are starting that, but it's very hard because the Minister of Health does not want to talk about NSPs in prison, and because these prison systems are state run, not generally Commonwealth run, but yet we are really working on this. So I'm just wondering here, um, as Esha said, support and health, not punishment, is a just response to drug use. Esha, would you sort of like to expand on that a bit for us?
I think throwing people in jail just for a little bit of like possession of like personal use, or even having equipment on you, or like anything like that. Like, why throw us in prison? We don't have like kilos and kilos of stuff. So we're usually using it for our personal use, not to supply to anyone. I think it's absolutely
Yeah.
ridiculous. Like people self-medicate themselves all the time. They don't throw someone away for having 2 bottles of alcohol because they're self-medicating themselves. Um, like it's just absolutely ridiculous. Getting charged and thrown in jail if you've got one syringe on you that you haven't found a bin falls and it's capped and everything. Like, please, I think like the police have got better, can spend their time and money on catching, like other people than us personal drug users and throwing us away.
Very true. Yeah, very true. How do you feel about that, Mark?
I agree completely with everything Esha said there. Yep. they just seem to provide as many blockages and things to make it harder, and just people getting prison time for a small amount of drugs. It's crazy. I mean, just the, the, the amount it costs to hold someone in prison, it's like, I think, a couple of $100 a day or something like that. And it's costing the government a lot of money, and these people shouldn't be in prison to begin with. So, yeah, I agree with everything Aisha said.
I find it
Well,
really I find it really upsetting that young people get busted going to a festival with pot or a pill or whatever, and they've got a criminal record for the rest of their lives. You know, and I know two individuals that quite close to one was on track to be a teacher, school teacher, and went to a festival, got caught with two eckies, and there goes any hope of being a school teacher. You know, so lifelong dreams gone, maybe because of bad decisions, maybe bad law. I think bad law rather than bad decisions. But you know, surely we've got to be able to come up with some way of making that situation able to become part of a civilized and working society. Because the minute he gets a criminal record, he's screwed for lots of roles and stuff like that. So
yeah,
we,
you
we're,
are, yeah.
we're forcing him to Centrelink, which just costs us working people something, you know, and whatever else. And I know it's not about that part of it, but we're forcing them to Centrelink because I'm really lucky. I work for Newer, and they know my criminal history, etc., etc. But not everyone can work for an organisation like this, you know. And you front up with it, and you either lie on your application so that you don't put it there, and hope to God no one sees it, or you tell them the truth. And either way, somewhere along the line, they're going to find out, and you're going to lose your job again, and so you're back to
There's
Centrelink.
a stigma. There's a
Yeah,
stigma
Mm,
attached to it, isn't it?
and you know,
And when you have to do a police check, it's on your police check, so you're not going to
yeah.
be able to get a job for a very long time.
mm,
Yeah, and we're talking about 18 and 19, 20-year-olds at this festival, and they're getting done for these minor drug charges, but it still sits there, you know? It's not
mm,
sponged off or anything else either. So
Hmm.
maybe something could help with that. Because let's face it, we're all going to have a pill or something else when we go to a festival. That's happened. It's reality. So let's work with what we know.
Well, we all have it outside. Yeah.
Yeah, well, but work with what we know. And then if there is an issue with it, like Dance Wise here in New South Wales and pill checking have been going out to festivals and doing the checking of the what's in the thing for make sure it's not too harmful. But let's try and work something like that. They're going to take these pills. Let's get if they're caught with them because it's still illegal. Let's work out a way that they can, I don't know, do community service with no criminal conviction or something. You know what I mean? Like something that doesn't ruin their lives over one afternoon.
I
Yeah,
think that like
exactly.
comes overall, if you get done with a little bit of drugs for personal use, like what's the point of going through the whole court system and wasting
Mm.
money when they can put the money towards something else? Like, if it's
Mm.
only a little bit, like if they can see it's for personal use, and the police in Queensland just target people when they've got, known for having personal use just to throw them away or just to get brownie points for the day. It's just
APIs.
ridiculous. Like just
Mm.
yeah, just drives me crazy, really.
Think all of them, all drugs need to be decriminalised under a certain weight amount, and then we wouldn't be chockering up the courts with these people. People wouldn't be getting criminal records for a trivial amount of drugs. So I think decriminalise everything. I'm not
Mm,
saying so we can walk around with suitcases full of gear, but if you get caught with a little bit, why clog the system with all this crap? I mean,
mm,
if you said before that there was 3.9 million people that admitted that they'd used drugs,
Yeah.
imagine all the other people who weren't honest on that survey. So that number's probably even way bigger. So decriminalise the lot is my answer.
mm,
And someone just sort of mentioned because, as Ash just said earlier, you can get in Queensland, you get picked up having a used needle on you and you can be prosecuted. And some say also it's anonymous, I don't know who it is. Supply quantities are also incredibly low in a lot of jurisdictions, which doesn't look like the reality for personal use. So if you've got over a certain, say, if you're using methamphetamine, I think if you've got over 7 points or something on you, it goes automatically that you're a dealer, you're a supplier, which for most people that would just be a weekend or a night or something like
Mm,
that. Um, so it's not the actual, it's not reflecting reality of personal use, which is
Mm.
yeah.
what we're saying. Yeah, and also, why are the penalties going on the end user? That's
Mm.
the other question people are asking as well. Um, it seems I've got so many questions here, I'm not going to be able to get them through. I think everybody's going to try and jump in a second. Um, so, in New South Wales, our diversionary scheme for possession is discretionary from the police, meaning they can choose to use it, and apparently they have to fill out paperwork, so some can't be bothered. But literally, another agreement that the goal should be to criminalising drugs, similar to stuff that they're doing in the ACT.
Mm. They do have
Michael,
these police diversion programs in Queensland, but it is, like we had a talk from the police minister, and it was like, yes, like this, if it's only like say a bad or a point or two, it's up to the police to be able to their discretion to be able to give you the drug diversion or not. Look, I've been done with not even a point, and the police said there was no chance I could get to drug diversion, and that was the only thing I was charged with, and that's what she was saying. If you're only charged with like one drug, and it's like I think it was less than a gram or something, they should give you police diversion. It's a load of rubbish. It's up to their discretion if they want to or not. So, even if they say it's, that's what's going on and that's the rules, it's a load of bullshit.
Yeah.
and if you get diversion here, there's nothing to stop you going walking around the block and coming back and bumping into the same police and giving you a second one, and then the third one is automatically a charge. Pretty sure that's how it works in New South Wales.
Yeah.
It should be mandatory one way or the other, or it should be a different system.
Thank you. And Mark sent me a question which I really like. And he wants to talk about what are the best alternatives to custody and how do we make the drug courts and home detention supportive rather than punitive and pathways to failure? Has anyone got any ideas what the alternatives to incarceration could be?
Ankle monitors, living at home, reporting to a parole officer once a week until you get whatever. But living at home, when I go to jail, my partner suffered much worse than I did because I got fed and clothed and had a roof. He had to find money to buy food and pay the power bill and all the rest of it. So that would be the same with lots of families. So if I was still at home, I could have still gone to work, still brought the money in, and the pain and suffering to family would have been much less. And I know that I'm lucky to be on the outside, for instance, and therefore I hopefully will be a good boy and I'll attend my parole things and whatever else. It's not going to be a fail-proof system, but it doesn't take you away from family, and it allows you to be a productive member of society, even if it's with an anklet bracelet on.
Mm.
Yes, what do you think? Home
Ah,
detention? Do you think there's halfway house? What do you think
look, I
would be a
think a
good?
halfway house or something like, even staying at home with an ankle bracelet would be great because like they're, for a lot of guys that are institutionalized, it's just an easy way out for them to go back to jail because they're so used to it. It's quite hard for them to adapt to society, and like parole wants them to be on Monday at 9 o'clock to be in jail, like to report. Like there's no like clocks in jail, so they don't even know what time 9 o'clock is or what day it is. So I feel that they need to be more adaptive to people who, have been institutionalized for most of their lives and try and work with them a bit better, saying, okay, we won't hear at 9 o'clock on a Monday, you're going back to jail. Like there's no time in jail. You don't count the time or days or dates in jail, and you just go along
Yeah.
and you know what time it is from the muster calls, and that's around about it. So they need to work with a lot of the people getting released from jail much better to make it, so they can make it easier for them because it's not their way or the highway. They need to adapt to, like what their lives have been like.
And I'll just sorry to interrupt this because suddenly, anyway, hello, Emily. Sorry about that. We've only got about 10, 15 minutes to go, but I just wanted if you'd like to introduce yourself. And I know you're very interested in talking about opioid treatment and the punitive approach and post-release deaths. Would you like to just talk to us about that for a few minutes? And we can't hear you. We
Uh,
can't hear
I'm
you.
going.
Yeah.
Oh, now I can hear you. Now I can hear you. Sorry, Richard. I'm so sorry. Oh
Okay,
my God.
so I know you asked about post-release preventable deaths and access to opioid treatment inside the
Yeah.
checkpoints and punitive approaches. Would you like to just, sorry, we've only got a few minutes left, but thanks for joining
That's
us.
okay. Thank you. Sorry, I apologize to everyone. I had the event in my calendar for 12 o'clock. So I'm so sorry about that. I don't know what went on there. But yeah, my name's Emily. I, like my panelists here, have a lived experience of incarceration, spending about 5.5 years in prison throughout my adult life. And yeah, due to a heroin dependence. And yeah, I just think, we're creating a whole underclass of people. Like the government is actively creating an underclass, at the moment where, at the moment there's very little housing for us when we get out. If you're lucky enough to get any form of harm reduction in prison, if you might be the one in every 700 people that might be the 12 people that get to attend a Quinn group, or that's up here at Queensland, sorry, or a harm reduction or AOD group. Even then, like harm reduction is kind of a foreign concept in prison, because you're up against this punitive system. So, you're getting urine tested, that leads to breaches, breaches, you get separate confinement or solitary, you get your privileges taken away, it affects your parole eligibility. So, yeah, harm reduction in prison, it's just like these two kind of polar opposite sort of concepts, because we need to change the basic approach to drugs in prison and in corrections. But yeah, I brought up about the overdose situation because up here there's been just in the last 3 months there's been 3 women who've overdosed fatally after getting out of prison, and prior to that, like, we've got 30 people. We're trying to keep a record at Peer Connect. That's a Quiver program in Queensland. There's been about 32 that we've counted just in the last 2.5 years who have died fatally overdosed after getting out of prison, in that first 4-week period, that really high risk period. So I just wanted to raise that, and that the impact of access to opiate treatment inside, peer support, which is like non-existent really up here, not for lack of us trying or the good work that's happening, but
Yeah.
we just can't get into the prison really, or but yeah, so I just wanted to raise that awareness, and even basic stuff like naloxone isn't happening, where people aren't getting given naloxone training in there, nor are they getting naloxone when they're being on their day of release.
Yeah.
Thank you.
I mean, I just want to ask, I was asking the panel, so what harm reduction minimum do you think every prison should meet?
Sure. Yeah, I mean, at minimum, it should, you should have immediate access to opioid treatment. At the moment, certainly in Queensland, people are waiting 12 months for opiate treatment. Particularly the men's prisons are really bad wait lists. People get out and they get in and they get put on the wait list, they get out, they're still not on opioid treatment, and they've and
Yeah.
so just things like that, naloxone, access to hep C treatment and testing and management in there. I had a friend who passed away only 4 years ago from hep C related liver disease in prison. And yeah, people are still dying of hep C in prisons, especially the folks who use drugs who get put in special, the secure units. We can't progress to low security often. And it's sort of this vicious circle. You get stuck in what they call like the secure, or like the maximum of the maximum sort of thing, maximum security. And then you just can't progress, and you're just with other people using drugs, and there's no support, and it's just this constant cycle of going into the DU, that's the detention unit, punishment unit, or management units, and then getting out. You might get parole if you're lucky, So yeah, we just need a whole other approach to it, Richard. Yeah.
Right, and just when you popped in, we're talking about what do you think the best alternative is right now? How do we make drug courts and home detention supportive rather than punitive? which is setting up
Yeah.
pathways for behaviour. What do you think about that? What could the alternatives be?
Oh, yeah, I think that's a great question. You know, yeah, drug courts seem to work well for some people, but like probably what people have identified, it again, that can just prolong, you know, your sentence. Instead of maybe doing 12 months, you're in and out for like 4 years because you're failing drug tests or, you know, using and yeah, so we just need a whole other approach, a harm reduction, human rights based approach, I think. Treating people like humans would be a great start. You know, that classic thing of like drug use as a health issue and a bodily autonomy issue. And then, drug dependence doesn't happen in a vacuum, you know? Like I think we talk about the bad drug users or the good drug users sort of thing. And it's like, well, you know, I was what you would call like a really, you know, problematic kind of, you know, I was very dependent on heroin for a lot of years. But even that doesn't happen in a vacuum. Like there's a lot of structural factors that kind of contribute to that dependence, you know, the secrecy, you can't be
Yep.
honest. You know, I was talking to someone the other day who just gotten out of prison. They're on parole, and you know, they said you can't tell the truth, but you can't lie either. like you kind of, you know, like you can't be too honest. You can't lie. Like you just so, and you know, for people who might want to change their drug use, being honest is like the number one thing that you know helps, right?
Yeah, absolutely, absolutely.
Yeah.
And I think we're just sort of going back to where we started before to the closing remarks. But I mean, with all the thing that the thing of this webinar is about that putting people in jail for drug
Mm,
use is
yeah.
um, it's against human rights, basically. It's
Yeah.
punitive measures. I'd like to hear your thoughts on it personally.
Oh, on the putting people in jail, yeah, absolutely. For me personally, like and like so many others like me, like I went to jail initially for like 2 months. My last
Mhm.
sentence was 3 years, you know, and it's just this escalation that kind of happens. Um, yeah, it's as I was saying, it's creating an entire underclass of people at the moment who
Mhm.
kind of fund a whole industry. There's a whole industry that's kind of profiting off of, you know, the war on drugs. So policing, corrections, prison, you know, etc. So yeah, we've got to look at who's benefiting from the current status quo,
Mhm.
and how can we make it more equitable for those like us on the panel whose lives have been, you know, forever changed by incarceration. Yeah.
Mhm. Esha, how do you feel about what's your closing remarks towards this?
Look, I feel that the social justice system treats us like children, and we get told to do, you know, like have a shower and you know eat when we want, etc., etc., etc. I think they should all treat us like adults and speak to us like normal adults. Even like with drug court, you get told what to do all the time, and you get spoken down to. Like we're not children, so I think we should become like Portugal and just like decriminalize it, and the jails would be really quite empty, and maybe we could house people in the old jails or something. I don't know. They've done something with Bogger Road now that they could, you know, like I think it's like a tourist event or you know, I don't know, an event where you can hire it out to do events there. I was in Bogger Road. I wouldn't want to do an event there if my life depended on it. But, you know, just things like that. You know, like just decriminalize, you know, personal possession of drugs, and the jail system in Australia would be quite empty. And the police probably wouldn't have that much to do for themselves, and even with the court system. So it save a lot of
Exactly.
money.
Mark, how do you feel about this? What was your closing remarks, Billy?
I agree with Escher again. Decriminalise small amounts, and yeah, the jails wouldn't be full. They wouldn't be building new jails. All this stuff that just goes into the whole system. Yeah, just decriminalise small amounts, and yeah, that's my answer, and that's all
Thanks, Mark.
drugs.
And Rod, what about
Um,
you?
I'm going to be the wishful fairy and say that organisations like Harm Reduction Victoria, Quiver and Quinn, ABLE, NUA, and the other states' bodies that are working towards doing something about this. But we need general public support. We need that to write to your member and try and do something about this, because really it could be your son or daughter who goes into jail next, and those sorts of things. So if we want to really be sensible about this and put it away so that no one else has to suffer, change the law, make it so we're adults, make it so that we are allowed to make mistakes without that, that little mistake ruining the rest of our lives, whether it be the workforce or who knows. But, we've got to be a little bit more, we'll be a bit less jail colony and more progressive civilization.
I fully agree with you, Rod. And I think what you said before regarding the families, like say, for example, I went to jail. I was sweet in jail. I had a bed. I had 3 meals a day. I had, not married toiletries, but, that was okay. But it's the families that suffer the most, not, wondering what's happening. If you don't have phone money, you can't call them for a while, stressing out that there's something happened to you in jail, etc. I think there needs to be more support for families that have family members going inside, because they don't realize the effect mentally, physically, and spiritually of the families that are on the outside.
Yeah.
Great, thank you. Look, we're coming to the close of today's session, so I want to thank each of the panelists. Thank you so much, especially for your honesty, your expertise, and your commitment to justice and care, and just being so open with us all. Thank you to everyone who's joined us today and asked questions. I'm sorry the questions, we haven't been able to get to them. But what we've heard today is clear. People who use drugs are not problems to be managed. People who deserve dignity, safety, healthcare, and opportunity. We've talked about what happens inside the prisons. We've talked about the deadly risks people face when they're released. And we've talked about better pathways, ones that centre health, connection, and support instead of punishment. Now, none of this is radical. It's actually evidence-based. Okay? It is humane and it works. Justice is not about cages and control. It never has been. It isn't. It's about keeping people alive. It's about giving people choices. And it's about creating a system for people to heal rather than to harm them. So if there's one thing you take away today, I really hope it's hope. Change is possible. And this is already happening, as we talked about earlier, because of my panelists in the room. We've already started this conversation. But it does require courage. It requires collaboration, and it requires us to keep centering on the voices of people with lived experience and peers. This is the most important thing. So thank you for standing with us. Let's take what we've learned today back to our workplaces, our advocacy services, and most of all to our communities. I want to keep pushing for systems that choose care over punishment. Let's keep reminding decision makers, this is so important, as Mark said, the people, the decision makers, keep reminding them advocacy services, keep pushing for this, and that we want health, dignity, and justice are not optional. They are human rights. So thank you all for being part of this conversation. I look forward to working with you all again, and thank you for joining us. Bye.
Thank you.
Thank you,
Bye-bye.
everyone. Bye.
Bye.